On this video presentation, I will discuss the bacteria Francisella tularensis. So Francisella tularensis is under the group of small pleomorphic gram-negative bacilli. It is an obligate aerobe, small gram-negative coccobacillus with bipolar appearance. It is non-motile, capsulated, and an intracellular bacteria. It is also under the category A potential bioterrorism agent that requires a biosafety level 3 containment for sample processing, and its vectors are deer flies and ticks, and its reservoir are the cottontail rabbit, and is the main pathogen of the disease tularemia. So tularemia is an infectious disease which also known as the rabbit fever or deer fly fever. It is a highly infectious disease or pathogen that can affect various animals including humans. There are also 6 forms of tularemia depending on the route of infection. First, we have ulcer glandular tularemia. It is the most common tularemia that causes skin ulcers with swollen lymph nodes. Second common is the glandular tularemia, which causes swollen lymph nodes, however, it doesn't cause skin ulcers. Third is oculoglandular tularemia, which is an infection of the eye that causes conjunctivitis and lymphadenopathy. Fourth is oropharyngeal tularemia that causes throat infection or ulceration in the oropharynx. Next is the typhoidal tularemia, which is also known as systemic tularemia, and it does not cause ulcer and lymphadenopathy. And the last is the pneumonic tularemia, which transmits through inhalation of infectious aerosol that causes lung infection, and it is not associated with septicemia and pneumonia. That is why it is the most serious form of tularemia. For its laboratory diagnosis, the specimens needed are scrapings from infected ulcers, blood, gastric aspirates, and sputum. And the best specimen to be in order to diagnose this organism is lymph nodes biopsy. For its biochemical test, it is weak positive in catalase test and beta lactamase test, and negative on urease and oxidase test. In order to visualize this microorganism, it requires an acridine orange stain, which are obtained from blood culture bottle. It can be seen under the microscope as a gram-negative bacilli with faint bipolar bodies. It can grow on CAP, TSB, or trypticase soy broth, MTM, or modified thiomartin, and BCG, blood cysteine glucose, BCYE, buffered charcoal yeast extract, and CHAB, or cysteine heart agars, which are supplemented with 5% heated sheep or rabbit blood. Uncapped colonies are round, smooth, bluish gray to white, and slightly mucoid. However, it cannot grow on MAC because it is a fastidious organism. It needs additional growth requirements like cysteine and thiosulfate for additional growth factors. It is also a slow growing organism which requires 2 to 4 days prior to the colony formation. And that's all for Francisella tularensis bacteria. Thank you for watching or listening.